A 63-year-old Chinese man presented with nausea, vomiting, and low-grade fever for 3 weeks. He received antibiotics for suspected infection for 1 week without clinical improvement. 2 weeks prior to admission, the patient was seen at the other hospital. Lab test results showed hemoglobin 9.3 grams per deciliter, serum creatinine was 13.3 milligrams per deciliter, the urine protein was 2 positive, and the RBCs in the urine were 3 positive. He was then referred to our hospital. He had a previous history of tuberculosis pleurisy 40 years ago and hypertension for 3 years. On admission, the temperature was 97.9 degrees Fahrenheit and the blood pressure was 150 by 85 millimeters of mercury. There were bilateral inguinal lymph nodes, bilateral inguinal lymph node enlargement, splenomegaly, bilateral lower extremity edema, and local skin hyperpigmentation. Neurological examination was significant for hyperalgesia, thyrohyperesthesia, meroparesthesia, and hypopalasthesia below both knees. Patellar tendon reflex was diminished bilaterally. The renal biopsy was performed. Now, what can be the possible results of renal biopsy? What are the further investigations you would like to do to confirm the diagnosis, and how will you treat your patient? You can do the differential diagnosis and treat your patient only when you have a thorough understanding of plasma cell disorders. sqadia.com is bringing a complete lecture of 40 minutes on plasma cell disorders along with short videos. Simply go to sqadia.com and subscribe to watch the complete lecture.